I'm Steve Reed, along with Susan Turk, the co-chairs of Missouri Progressive Action Group. This meeting will be recorded and posted to mopag.net in the next couple of days. I'm pleased to see that we've got legislators and candidates join us today. Sarah Onsecker, Lakeisha Bosley, Luke Barber, Melissa Greenstein, and Colin Lovett. Let's have our treasurer's report from Christina Anderson, and then we'll get down to business.
Okay.
Christina.
As of today, we have $942.56 in the bank. So it's $942.56.
Okay, thanks, Christina. So a member of our organization, Don Logue, he's going to be doing the presentation today. Don's got decades of experience in a variety of roles with public health care. Also mention questions or comments, raise your hand or post on the chat. And this is very informal, and we'll try and have good discussion, good participation. Okay, Don, I'm just going to turn it over to you then.
Okay. Let's see here. Have I shared that screen yet? No. Okay. Can everybody see that?
Yeah.
Yes.
Okay. So thank you everyone for coming out. And I know you're all very busy and it's the heat of battle with the campaigns going on. We don't have a huge crowd, but we have we have thought leaders here, people who I think can appreciate what I'm trying to provide here today. As my intro indicated, I've been engaged in human services delivery for a long time, so I appreciate your challenges. And I'm here today because I want to help you with your mission. The objective this afternoon is to quickly review the concept of public health, the status of public health in Missouri, and then facilitate a meaningful discussion of the public health issues from a political perspective that can hopefully translate into refined policy positions and effective campaign messaging. Before I begin the PowerPoint, I would like to digress with some historical perspective. From 1986 through 2007, while living here in St. Louis, I spent my time commuting to Florida, Illinois, Kansas, Massachusetts, South Carolina, and Texas, fixing what was broken in troubled senior housing, long-term care companies. In that process along the way, I learned a lot about the industry, in particular, the institutionalization of elderly and persons with disabilities, that option should be one of last resort, that institutionalization, I underscore, and not a decision by default. My mission then became facilitating and developing alternate options. In 2007, after completing the last of a long list of turnaround projects, I was invited to Costa Rica to explore long-term care opportunities. In touring various healthcare venues there, I learned about adult day services, a form of what we now call home and community-based services, which was also at the same time gaining traction here in the US. Since then, I've worked as an adult day services advocate for that innovative delivery model here in St. Louis, as well as in DC. Costa Rica remains today an interesting example of success in public health from which we can learn. The advocacy work has along the way included some fascinating discussions with various members of Republican leadership. I've developed an understanding of the need for much of what I'm sharing with you today from those discussions. I know you're all busy, so we're going to flip through the slide deck quickly. Everybody had a copy of this in advance. I hope you did your homework. So we will proceed to slide 2. So when we talk, I think it's important, particularly in light of what we're seeing in the political debate today, to start with the basic definition of what is public health. And it's science. It's the science of protecting and improving the health of people in our communities, not some government conspiracy created by liberals to justify more government spending and an unnecessary intrusion to people's liberty. I think it is important to also note that to be effective, it needs to operate at all population levels, including small local neighborhoods. Why is it important? Well, I think based upon what we've gone through over the last 3 years, that should be clear, although surprisingly, Republican leadership continues to try to impose an alternate reality. We're certainly supposed to be preventing pandemics from happening or reoccurring, rather than just letting them rip through our communities. These should not be abstract concepts. They're fundamental to creating and maintaining a stable society. So, moving to slide, well, I should have advanced here. Moving to slide 4. This is extremely important in that it graphically illustrates the complexity of public health systems, the relationships that exist, both public and private. I know it's a little foggy, but my graphics arts department is, my budget there is a little limited. So I'm taking from the web this diagram, but it's extremely illustrative of how complicated the systems of public health are. And if any one of these links is weak, it undermines the whole system. So we have to approach public health holistically if we're going to be successful. Slide 5 details some of the core functions and essential services that a public health system should provide. And I include this because this is foundational to what enabling legislation and the structure of public health agencies should reflect. And I think we have a lot to do in this regard here in Missouri. This slide you have probably seen on many other occasions. And the first thing I want to say is this does not include the implications of any genetic factors that we inherit. This is focused on those areas upon which we can have an impact with public policy. And, I'll let you can study the details, but what's particularly significant here is that while a lot of us think that the mission is, for the most part, achieved through our healthcare providers and delivery networks, the clinical experience, the reality is that 80%, and these are relative estimates, 80% of the factors that determine health in our communities are in these other areas, which we can dramatically impact with public policy. So today we're talking about public policy and the role of government. So what I've listed here are the players, the significant players from a governmental standpoint, which is regulatory as well as also from an insurance standpoint. We won't get into the insurance issue today, and hopefully we can have a discussion later about that. But from a regulatory standpoint, at the federal level, the Center for Medicare and Medicaid Services, otherwise known as CMS, really controls the landscape of so much of what we are able to do, both as providers as well as regulators. State of Missouri has the 3 different departments, which we'll talk about a little later. Regionally, different states have different, and different communities have different organization from that standpoint. But I would say an example here is the areas of agency on aging. And we do find that there needs to be strategies at a regional level. We're all familiar with the county public health departments, given what we've gone through with COVID-19. I would note city of St. Louis is, from a healthcare standpoint as well, it's a county when you go to do any research on healthcare outcomes. And so they have their own department. Municipal, 40 years ago, when I was in public service at the local level, we didn't talk about healthcare. But today, it's clearly local mayors and local public officials have an important part to play in this, the concept of creating a public health system. This slide details the strategic pillars outlined by this current administration in talking papers that they've done publicly. I'm not going to drill down into those at this point, but I think you can see that there is an ideology there. And I note advancing health equity is number 1. These are certainly strategic principles that I can buy into, and I think from a progressive standpoint make a lot of sense as this all filters down at the state and local level. Notably, in my journey, I said, well, what is driving the ideology that exists at the state level? And it makes you have to turn to the Constitution. Everybody wants to be constitutionalists these days. What does the Constitution say? And I think this citation indicates that despite all the rhetoric, the state has a very important responsibility to promote the general welfare of the people. And reading on through, if it does not meet up to that responsibility, it fails. And it's a reasonable question when you look at our outcomes a little bit later, whether or not we have a failed state when it comes to healthcare in the state of Missouri. So let's take that next step and look at our system. So this is a map that I created back in 2014 by going to the various websites and trying to, create a mind map of what is our public health system from a state perspective, and begin to talk about that with leadership, principally Republican leadership, and talk about that in terms of, is it really functioning so as to achieve that general welfare expectation in the Constitution? And I used it in testimony before the House Government Efficiency Committee that was for a bill that would have reorganized at least 2 of the existing 3 departments that we have engaged in public health here in Missouri. And the sum and substance of that initiative was, you know what, we agree, these are private conversations, but this is just too big a challenge for us to take on. And along with this, I was having conversations with my representative, who at that time was prior to this and still a major player in the healthcare budgeting process, Sue Allen. She was my representative. She described the budget for healthcare in Missouri as a giant egg that no one could crack open. Now, when I first met her doing my advocacy work in Jeff City, she says, look, I have this budget that I have to work out in the next 7 days that I just received from the governor's office. Can you please help me? Now we're talking about $8 billion at that point in time. So John Doe citizen walks through the door, and this is the way we function in terms of budgeting for healthcare in Missouri. Does not sound good. So we had a change of an administration subsequent to that, which I'll talk a little bit further about how that has evolved in terms of the formation of public policy. But this slide, again, going back to the web and the consumer's perspective in trying to understand who they go to resolve or to get the services that they believe that they qualify for. These are the mission statements to the extent I was able to extract them. And I'm not saying that they're necessarily good or bad, but I think it reflects a certain degree of disconnect in terms of the level of sophistication, in terms of how they've developed these and how they communicate those, that also translates into dysfunction when we talk about the operational efficiency of the state's public health system. Next slide is, I've compressed it down to give you a little closer view of the three departments, the three public health agencies in essence that we have, as well as the immediate departments, divisions, boards that exist under each of those. And I'm not going to try to explain all the relationships that you saw in that earlier diagram in our conversation here, but needless to say, it's complicated, they're interrelated, and because they are not focused singularly and operationally, we have a lot of disconnects and inequities and a lot of problems with one department having one set of rules and another department having other rules, and families not being able and providers not being able to figure out what is the rule that they have to work with. So if you want to look at whether or not a system is functional, look at the outcomes. And here, and I've cherry picked this, and certainly there are some things that we do well, but these are significant in terms of, how badly we fail for so many people in this state. And I mentioned Costa Rica earlier. So we're comparing ourselves against the other 50 states, the other 49 states. But the fact of the matter is, America, the United States, is not one of the best examples of public health in the world. And we have other countries that have much better outcomes and we should and could learn from them as to their best practices. Needless to say, while pre-COVID-19, this was not as obvious an issue to be concerned about, but now it's clear that public health, if weak, if that social infrastructure is not strong, it has national security implications. And today, we're dealing with inflation as a major public policy issue, when in fact, if we had a stronger public health system, we would not be suffering to the extent we are today from that problem, and we would have saved a lot of lives. So when there was a change of administration in 2017, the Republicans commissioned a study with well-known consulting company McKinsey to do an analysis of the state's Medicaid system. And I don't think there's any secret that, but the desire was to figure out how to throw people more people off the system than to engage in the process of investing in the future of our public health system and the future of our citizens and their productivity and welfare. Having said that, McKinsey is a well-known and reputable consulting firm. So if you read the study, you can see that they defined two paths for the state to follow. One is more short-sighted, which is, hey, you can look to restrict access, and I'm truncating the conversation. But the alternative is to invest in modernizing the system to 21st century standards and best practices, and in essence, solving your budget concerns by reducing the reliance on the system by lifting people up. So if you should, and you can read the first 24 pages of that 115-page report, and there's a link to it at the end in the bibliography. And don't let yourself get lost in the weeds of the numbers, because it's very difficult to reconcile, because you're not always comparing apples to apples. But just look at the concepts, and it's clearly an indictment of the dysfunction we currently have in the system. Now, and I've mentioned dysfunction repeatedly here. And we have a lot of wonderful public servants working in those three agencies, but they are handcuffed by poor leadership at the top. And so the objective here isn't to denigrate or tear down the wonderful work that they try to do, but to focus on that failure of leadership at the top. So moving on to, that was, let's say, a first report that cracked that egg open and gave us access to a lot of details that were just simply unavailable prior to that time. Of course, after Greitens left, who's the one who commissioned the report, the Republicans have run away from this because they understand, I believe, that it says you need to make some major changes, and they don't know how to go about it and don't want to take that challenge on. So next we have highlights from recommendations done by the Washington University's Center for Economics and Policy. Again, I've paraphrased this, and the report you have access to. It's detailed at the in the bibliography, and I'm not going to get in the weeds of the primary care health homes, but it's an important concept when we talk about providing coordinated and comprehensive health care to some of the people in our state that need those services, that need healthcare services the most. And again, one of theirs saying at the bottom, prioritize a more coordinated and integrated approach to delivering social and behavioral health services, streamlining eligibility, and so on. And applying for Medicaid in the state of Missouri is it's like going through a gauntlet. And if you don't have a provider or some sponsor to walk you through that process, it's a very daunting task. This, what I'm doing here is highlighting the commentary, the analysis done by Clay Goddard, who used to be the public health administrator for Greene County. He recently became the director of public health transformation for the Missouri Foundation for Health. And, you know, again, we're talking about 50 years of hollowing out our social infrastructure by failing to adequately support workforce development at the local level, developing analytics that we have to work with in terms of knowing where we're at and where we want to go, creating measurable objectives, and you know, they need a lot of help. They have a lot of cases that people that need help, and they don't have enough providers to turn to handle those. So that's the local, the county perspective. So after, you know, looking at all the above, so what are the Republicans saying? What was their response in the pandemic? It's a war on public health. Even the governor couldn't get his director of DHSS approved because of this lunacy taking place in the legislature. We need to call them out on this. And then comes Roe versus Wade. Now, what I have here is a statement regarding human rights that is an international standard. And I think one of the things that we often fail to do is we focus on singular issues within our discussion of public health in this country, and don't go back to the basic issue of human rights and how individual people are respected, and at this point in time, particularly women, in terms of their control in making decisions over their own lives. So, what can we do about it? These are general strategies I've outlined here that I think can be good starters for discussion. And I hope that some of you have some thoughts as well along these lines, but I'm certainly willing to take questions. But more importantly, I want to hear what you think we need to do, because you're out there talking to people every day about what they're struggling with. And I know every family is faced with issues related to this subject. So with that, I'll turn it back to Steve. I can't hear you, Steve.
Sorry. Thanks, Don. Probably go ahead and quit sharing so we can all come up on the screen. If we need to refer to a chart, we can go back to it. Well, is, of course, a whole lot here. Who would like, now, Sarah Unsecker, I noticed before I came on, and unless my information is dated, she and Betsy Fogel are on the subcommittee on health, mental health, and social services. So
That's right.
maybe it's a good place to start with Sarah, because I'd really like to hear your perspective on things.
Well, putting me on the spot here. So,
It's okay.
We really need to be integrating our systems a lot more. But I mean, public health has been so denigrated. And so it's been put kind of not even on the back burner, but set on fire, really. You know, it's just not been a not been a priority, but it has been denigrated and made to be sound like something bad in our society when it's really something we need and one of the core functions of society. So that's
So
what
if I ask the question in the legislature, what kind of Republican appetite is there for improving our public health outcomes? I guess you just answered that.
I haven't seen a whole lot of initiative to improve public health outcomes. You know, when you point to a specific statistic or a specific issue, they'll take concern, but not on their own, not without being shown that these are problems that we need to address.
Okay, I have a couple hands raised. Ross, go ahead. You're muted, Ross.
Actually, Susan was ahead of me, but since you've called on me, I'll go ahead. I've read repeatedly that the system that allows people to enroll in Medicaid in Missouri is beyond inadequate. That in fact, when people have to dial in by phone, it's not staffed properly. The system frequently hangs up on them. What can we do? This was a constitutional amendment that was passed in 2020 to expand Medicaid. And yet here we are with this system still not serving many thousands of people. What can we do about that?
We need to keep putting pressure on the Department of Social Services. What I've been doing is I've been asking them for regular updates and pushing them and just putting pressure on them to say, why is it taking so long for people to enroll in Medicaid? Why is the system so broken? A lot of what they say is it's staffing issues and technology issues. They don't have enough people and they don't have updated technology to do what they need to do. And I saw Representative Bosley has her hand up.
I'm going to go to Susan. Susan, you had your hand up next. Susan, go ahead.
Yeah. I've only lived in Missouri since 1981. And I realize that's longer than some of you have been on the planet. But I come originally from New York City, which, although it is not paradise, does have a public hospital system and a commitment to providing for the general welfare and public health. When I moved to St. Louis in 1981, both the city and the county had public hospitals. Neither of those hospitals are now operating. And a few years before I moved here, the Northside Hospital, Homer G. Phillips, was closed. And Homer G. was an internationally known public health center of excellence, which trained many of the African American medical professionals who in the country. This was a mecca at one point. St. Louis was a mecca for public health excellence. And the downward spiral that has occurred here is particularly disturbing to me, and I've seen it over the 40 years that I've lived here. I understand that the state government is now controlled by people who insist on constantly cutting revenue, constantly cutting taxes. And it disturbs me deeply because we are not a poor state. And the only way that our public health issues and many of our other issues, such as education, which I'm obsessed with, are going to be dealt with appropriately is if we stop cutting revenue sources. And so I just, want to remind all of you who are going into politics, who are either serving in the legislature or planning to win elections to do so. I know that you can't talk to the Republicans about this, but can you talk to the people in the state about how they are hurting themselves by continuing to elect Republicans who are cutting revenue and cutting services, cutting their quality of life, destroying our healthcare systems, and shortening our lives as a result of that? Is it, you guys run for office, you try to get people to vote for you. What are our options?
So, Sarah, can I help out here?
Yes.
This is Representative Bosley. All right, so there's twofold things. What I was going to say earlier to assist is that not only applying pressure to the department to try to help with the Medicaid enrollment, but there's also another way that you can assist by having your friends and your family who live in outstate Missouri put pressure on their reps to find out what's going on and how they can get enrolled, because a lot of those areas and a lot of those communities are the ones who need that assistance. And Susan, to your point, yeah, we're running for office, but when you have the disproportionate lines of representation drawn the way that they are, where you have more people represented in rural communities than they are in the urban areas, but we're outvoting, and not only are we out economically performing them, but they have the larger vote in the party. So we have to do something about how we do redistricting, how we proportion that. But we also have to get people to stop voting against their interests. A lot of rural Missourians vote against their interests because they feel like the Republican Party is the party that is catering to their needs and their values, and they have discarded the Democratic Party because of the messaging. And I know this gets a lot of people riled up, but it's an unpopular opinion that, we have gone off the deep end to a sense of saying certain things. I believe that if we're asked about it, then we definitely stand in that and we stand for those issues. But when you have people in rural Missouri who are trying to find their way as Democrats and then feel as if they can't run as a Democrat if they don't check off the boxes to be a Democrat of a litmus test, then we lead ourselves into the position that we're in now, where a lot of Missourians have not switched from have not sustained and stayed blue, but have switched to go to red. So we're no longer a purple state. We're no longer a swing state. We're just a solid red state until we get our messaging right, and until we start touching hearts and changing minds and doing better in our education and our healthcare. That's the only way I believe that we'll be able to change those minds. So what we can do is reach out to our families and our friends who live in those outstate, Lynn County, Wayne County, all of these different smaller counties that have a population of like 500, and try to change some of those hearts and get people who are running in positions down there as Democrats to stand up in those local county offices for those issues that, we hold true and we value here.
let me also add, and Colin is in play here, and as well as Melissa, and that they are running 4 seats in suburban districts, which present some swing opportunities. And I think that, getting back to the messaging, I'd like to think, and it's a little bit of a slippery slope, but that McKinsey report also cited that the state can save $1 billion a year, and $1 billion is a lot of money, by embracing some of the, I'll say, common sense recommendations in the McKinsey report. Now, you can do that, and you can improve access and case management and care coordination without spending a fortune. Okay. I mean, with all the, and trust me, I have all these friends in Silicon Valley that we have all the technology, we have tons of technology that could immediately impact quality and cost. But they don't want to do business with some states anyway, because it's just, it's too big a mountain to climb. And so, but the fiscal point, and the last time I met was Andrew Koenig, okay? I said, you're being fiscally irresponsible when you're talking about layering a work requirement on top of a system that already is totally dysfunctional. Now, I was trying to get him to back off of that particular issue, but I think there's resonance there in these swing districts that these guys are nuts. They are totally irresponsible when it comes to managing our budget. And we are, and I know I've read it, but on a per capita basis, I believe we spend more on Medicaid than most other states in the nation.
Don,
So
I was looking at this also from a top-down perspective. Not only is there the subcommittee on health and social services, the legislature has a subcommittee on workforce development, on economic development, and it's obvious what a huge impact public health is on those areas. So you would think in a logical world that you would have allies over in those subcommittees, in a logical world.
and I have to say this because I've struggled with it for so many years. I think a lot of people just assume this is the way it's always been and there's nothing we can do about it. Okay. Now, the further extreme is, and I won't name the name, but he's a very influential mentor to a lot of people in the legislature. But his answer to my question about where's the conservative heart in meeting this obligation for the general welfare of the citizenry, and he said, well, there are a lot of fallen angels in this world. In other words, there are a lot of people in the state of Missouri that just don't count. Now, that's the Republican ideology, if you really drill down. They'll disown that statement, but that's a fact.
Well, actions speak louder than words, right? So Melissa has her hand up.
So my mind is racing because I feel like every time someone speaks, like something else pops into my head. So I'm going to be like, like a squirrel here for a second. First of all, what Don was just saying about, and you, Steve, about all the subcommittees and all of these things, you would think that if Republicans were true to what they actually claim to believe, which is that they think that there should be smaller government, then they would be happy with the idea that we restructure all of these organizations so that they work more effectively and more efficiently. So I think that's a really good way for us to approach them. And I don't necessarily know that it means that we actually make it smaller, but I don't know anything about healthcare. I'm an educator. So, but to me, it looks like this is like a whole bunch of things that are probably duplicating and or missing, right? Because two committees are probably doing the same thing and nobody's doing the other thing. So to me, that just looks like a big pile of spaghetti that we could probably work on. To Susan's point, Susan, I'm also from New York originally, not from the city, but from the state. And when I was growing up in New York, there was a program because I guess in the 80s and 90s, we were very low on math and science teachers. And so they offered some scholarships for you if you went into teaching math or science, and you never had to pay it back, but you had to teach in public schools for X number of years. So depending on how much money you had or how many years you had earned the scholarship, you owed time to the state. But it was a way for you to finish your degree with not having student loans. And then you come back and you serve the state, in the public school, which is what I did. I don't know why we couldn't do something similarly in Missouri if we are so short on any kind of health workers that we couldn't be doing something similar that would not only get us more of them, but then have them work for us here. So those were a couple of things that were going through my mind, but I'm also with Representative Bosley on the fact that this is like a funding issue. I mean, with the $15 billion that we have in surplus in Missouri, the fact that we've already voted and approved Medicaid expansion, like I don't know what the holdup is. I don't know why they're not negligible, whatever the right word is, for the fact that they're not coming through on all that. So I know that was like 42 points, sorry, like vomit.
Okay, I see a chat here. Okay, for Melissa. Sign up to support and volunteer her campaign. Maybe people should mention what districts they're in. I didn't get my homework done before I came on. Colin, you're running for what?
Yeah, so my name's Colin Levitt, for those of you I haven't had a chance to meet yet, and I'm running for state rep in District 100, which is Baldwin, Winchester, a little bit of unincorporated St. Louis. It's in West St. Louis County, and it's right next to Melissa's district, which is Chesterfield and a little bit more, right? And she's in the 101st. And I have a little bit of a healthcare background. I work for a big healthcare corporation, and one of the things that resonates with me. I really appreciate you guys setting this conversation up because I think it's so important and it's overdue. But a couple points in particular resonated with me. I definitely agree that it's going to take money to fix the problem, right? It's going to take investment in good people. It's going to take investment in making the structures more efficient and redesigning some of the way that we do healthcare in Missouri. And I can completely appreciate that the Republican majority, supermajority, doesn't have an appetite to invest in what Don referred to as the fallen angel community, right? There is a litmus test in their minds. I have some family who is in the Republican legislature, and I hear firsthand all the time about the means tests that they feel like they need to get government handouts. So I think first and foremost, what Representative Bosley mentioned about reaching out to friends and family outstate and trying to really generate an awareness for the need is super critical. But from a messaging standpoint, one of the things that I talk about at the doors is the economic benefit of addressing whole person health. And we see this, I see this in just my day job, right? That if you are able to prevent future and sometimes more drastic consumption of health, keeping people out of the hospital. Think of it from a prevention standpoint, right? You go to the doctor, you do your preventative stuff, and that keeps you out of the hospital. Going to the hospital is a lot more expensive than taking your preventative treatments, whatever those may be. And I know that's a very broad example, but the case is true with all of the various public health aspects of this as well. And if we can make more efficient the system to try and reduce health inequities and disparities across the state, there's an economic benefit to doing that. And ultimately, the taxpayers are the ones who get caught holding the bag when people consume healthcare and there's nobody left to pay for it. So I really think that there's an economic benefit to redoing this, and hopefully that message can resonate with some of the Republicans in the legislature. But at the end of the day, it really is going to come down to, in my opinion, flipping more seats blue. And, there's a couple in particular. I mean, mine is, we're 50-50 for the first time in at least 15 years. Melissa, yours is too. So there are seats that we can flip now. But, I guess I'm going to close with a question and a punt to Representative Unsicker, who sits on the committee. I mean, is there an opportunity to play around with budget dollars and direct? So I'll also just tell a brief story. The first time I met Don was at an event, and he asked me how much of the budget goes into healthcare. And so I was forced to do my homework and looking at how much of the Missouri budget goes into social services, health and senior services, and mental health. There's a significant portion of the budget. If I'm not mistaken, it's 42% of all of the money in Missouri goes towards health and various social services. Is there any opportunity in those budget discussions to channel the money to rebuild the infrastructure, whether that be technology, whether that be bringing in people? I know you mentioned that, one of the efforts was to kind of bang on their door and say, why can't we help more people? But is there anything that can be done outside of legislation where we're outnumbered and be able to do things at the administrative level that you found?
Absolutely. And I think that's where most of the action needs to be, is in the administrative level. As far as what we do, talking to social services, but you were talking about the budget. We need to have language in there, and we do try to put it in there to direct how they use the money. And we can't legislate through the budget, but we can give them some direction. And we try to do that. And so that's a lot of it. It's hard to move money sometimes. To an extent we can, but there are definitely limits. Representative Bosley, do you want to address that about the budget and what we can do? You've been on that committee longer than I have.
I don't see her.
Oh, is she not there anymore?
It looks like she dropped off.
Okay.
Okay. I'm going to go to Helena Webb, who's got a hand up.
Hey guys, it's nice to see everybody. I was just going to sort of pivot from Lakeisha's, Representative Bosley's comments. Our messaging is a real problem for people who want to flip seats. The Democratic messaging stays extremely left-wing, and I think we need to be more strategic. Even though people may want, Medicare for all or Medicaid for all or whatever it is, that's not going to get us those seats of the even moderate Republicans who just don't want to elect a socialist. And it's just really hard to fight against the machine of the party, which wants us to go super liberal when you're trying to flip these seats in these very moderate districts. And so I think this is a good conversation, because what Colin just said, it could be a talking point or a message we have to develop our own messaging. They still come at us with defund the police or socialist and all that stuff. But as these middle of the road candidates, which is what we're trying to be if we got to flip a seat, there's not enough Democrats to just ignite the base and win. There are Democrats out there, but we've got to get those swing voters. And so I feel like that's a great message. 42%, of the state budget goes to healthcare, and we're doing a terrible job, through, there could be a message about through better management and integration of new technology, we can do a better job without raising taxes. Maybe you don't want to say you can lower costs, but you can say we can do a better job without raising costs if we can just be smart about it. And I feel like that's a better message for out here. So I'm just listening and I'm just hearing, and it just resonated with me that might reach people. It's very tough to stand on the regular democratic issues of education, healthcare, and whatever the third one is at this moment. But it's really hard to stand on those because those are the divisive issues in the flippable areas. Education is extremely divisive in these areas. And so it's really hard to stand on that. So I think an economic message on a lot of these issues might be a good way to go out here. Obviously, Colin and Melissa have been knocking on the doors this year. I haven't done that much of it this year, so I can't say what's going on now, but that's just my gut. It's very difficult to run on healthcare for all and public education right now. It's really hard out here. So thanks.
Okay, thanks, Helena. Melissa?
Don, do you want to go first? You had your hand.
Well, I, for some reason, I don't have the hand option, so pardon me if I'm coming out of sequence here. But I think it is. I've done all this canvassing work over time. You do want to talk to your constituents about, so how's it going with grandma? Or, is your family have any special needs? And then you can play into the fact, well, gee whiz, if you've had trouble, or your cousin or your whatever, this is the real world, okay? It's like Eric Schmidt has a son who has special needs, okay? Families need, no matter where they live, they need these departments to be functioning properly, because even if not today, someday their mother or uncle or aunt is going to need to interact with that system. And so make sure that you kind of dig into that turf a little bit, because I had a former deputy secretary of HUD come to town, had a sister who lived in South County. He had no idea of how to help her age appropriately in a location. And guess what? There really wasn't any contextual help to guide him through that process. And so in family, I have a friend who's a friend of the Conservative Caucus. His mother, he put her into a facility and she died 3 days later. He's not happy. So yes, we have to figure out how to resonate and then message on these issues. And there's nothing physically conservative about the mismanagement that's well documented that's taking place. So I think everybody has to figure out how they want to address that, but it's total incompetence and it's well documented. So that's my taxpayers' dollar, and as well as your constituents. So, I'd be willing to have conversations with individuals, and there are people who want to try to help with that messaging that I can connect you with. But we need to take the gloves off. And I'm doing this, but I'm going to be taking this show on the road, because I'm tired of defenseless young and old people in our state being kicked to the curb, and it's barbaric.
To follow up, some of what Don just said was what I was going to say, so thanks, Don. I was going to say that one of the things that I'm running in 101, like Colin said, and that is Chesterfield Valley mostly. It goes a little bit east all the way to like 141 and Olive, but it's kind of a wonky horizontal shape. But one of the things that I've been talking about as we start to gear up now for the general and talking to people is that if you're not happy with something in this state, whether it is healthcare or education, I don't care, pick a topic. The Republicans are in charge. So any Republican running on the idea that we've got to do something so that we can do blah, 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 no, you're already doing it. You are the status quo. And so if somebody's not happy in any regard, you're looking for a change. And like what Colin and I have now been saying, we need 6 seats to flip to break that Republican supermajority, which doesn't mean that we win the House. It just means we win ourselves back to the table. So when we're sitting at that table, they can't just vote something in without us being a part of it. One of the interesting conversations I had, actually, Katie and I had the other day, we were at one of our polling locations, and there was a woman there for my opponent. And she got to talking to us, and she was asking us a little bit about healthcare and about schools. And I don't remember how the conversation turned to this, but she said, well, but you're for charter schools. I said, no, I'm not for charter schools. She said, yeah, Democrats are for charter schools. I said, no, Democrats are never for charter schools. I said, Republicans are for charter schools. She said, are you sure? I said, yeah, I'm totally sure. Then she said something about, she got to talking about how she'd been a social worker and a nurse. And I said, right. I said, I'm for Medicaid expansion. She said, you are? I said, yeah. And she said, I'm for Medicaid expansion. I said, welcome to the Democratic Party. She had never voted in her entire life. My opponent came to her church and spoke, and she got signed up. She pulled a Republican ballot and voted for him. And she got done talking to us, and she said, I can't believe I didn't know this. So the fact that we have to be able to get out there and verbalize these things and say these things, you know, she was like, yeah, but you're for privatizing things. I said, Democrats? We're for privatizing nothing. And she was shocked. And it was it was a fascinating conversation, and she took it very well, and even said that she was going to go back and talk to some of her Democratic friends and try and learn more. I mean, she was obviously ill-informed, but I would say that there are an awful lot of people who just follow like lemmings and believe whatever it is that one person tells them. And so we get the bad rap on both sides. Somehow I'm getting blamed for what the Republicans do and for being a socialist. Like, how can I be all of those things? So I have also been on the doors hearing a lot from people that what matters to them is democracy more than even inflation. I mean, I hear about inflation some, but democracy, and they just want people in Jeff City to work together so that they can get something done. And that's when I pivot back to what Colin and I have been saying. Well, we're never going to get there unless we bring enough Democrats back to the table that they have to work with us. Until we get to that place, we are outvoted every single time.
Okay, Susan, your hand is up. Or
Yeah, I just wanted to say, listening to what everybody's saying, that when it comes towards being pro-life, it's the Democratic Party that's pro-life. We're the party that supports services that will prolong people's lives and improve people's lives. And you know, the Republicans are always stealing our messaging and projecting with things that we say, well, we ought to throw it back at them and say, what is pro-life about you? Because you're cutting services for food for people, for whether it's senior lunches, whether it's school lunches, whether it's veterans health care, whatever the heck it is, everything the Republicans are doing makes life less, possible. And we're the ones that are improving it. And so I just think that that's a message that we need to adopt and fight back with.
okay, Don.
So I wanted to save the abortion discussion till later on, but it's appropriate here, I think. And I'll share a personal story. And I've done, if you Google abortion and miscarriage, any of these medical terms, there's an interesting history there, but the fact of the matter is, I had a daughter at 24 weeks in her pregnancy. We were all called to the hospital, and they said she and the twins that she was bearing at the time may all die today if we cannot be successful in performing surgery. Now, fortunately for her, she has a good employer and she has excellent healthcare insurance. And so she had access to the finest healthcare in America to save her life as well as the lives of those children. But now, women in this state, the whole process of receiving reproductive health care is in total chaos, because what is it? 1 in 3 women experience a miscarriage during their lifetime. And typically one of the common procedures is that you needed a D&C. That you may not have access to that right now. And will you be forced to carry a fetus that's no longer, not just not viable, but has died until it's naturally evacuated? These are meaningful discussions that every household in the state should be having, because we have the lunatics in charge of individual women's healthcare decisions, and it's barbaric. And so we don't even have to talk about abortion. We're just talking about normal, traditional, reproductive healthcare that every woman should have access to, no matter what and it's under threat, no matter what their insurance position is.
Ross Hunt asked a question in the chat that I'll ask Sarah or anyone to address really. Is the Medicaid enrollment process intentionally cumbersome and inefficient?
Yes.
Can we provide for online sign up and automated verification processes?
I'm not going to talk about anybody's intent, but as far as providing automated verification procedures, they are working on doing some of that stuff and automating things. They've been working with Health and Human Services with the federal government and have a mitigation plan to help catch people up and catch it up to where they should be with enrolling people right now for expansion.
Okay. On the messaging side.
But
It's
Colin has his hand up. Before you go on, Colin has his hand up. Sorry.
Oh, okay. Sorry. Colin?
Yeah, no, thank you. I actually forgot I had it up because Melissa hit a couple of my points. But I was just going to say that, yeah, some of the conversations I've had at the doors, people are misled by a lot of the Republican talking points, whether that be at church, whether that be, one-on-one, or, somebody told me, or I watched this thing on YouTube or whatever. And, one of the strategies that we've employed to try and combat that as best we can is to bring these conversations into terms that they're talking about and they're comfortable with. And, even from a more moderate or traditionally Republican side, and I go back to the economic argument behind some of these things, we know that as Democrats, we're for making sure that people have access to healthcare because it saves their lives and it's the right thing to do. But in the messaging, we need to be talking about it in ways that people who may not agree with us, at least at that level, understand. And what resonated with me was the whole defund the police conversation. When Helena ran last time, they sent a mailer out that said that she was out for defunding the police, and then Derek Grier wound up voting for the bill that actually defunded the police. So it's talking out of both sides of their mouth, but really confusing the folks. And I can't stress enough how important it is to have conversations, whether it be at the door or at the grocery store or with your neighbors, and try and go a level deeper and find out what people perceive the conversation to be, and try and, get them to understand that it's not the people who are currently elected that are necessarily representing their best interest. The only other thing I'll comment on is Ross's comment on the Medicaid enrollment process being cumbersome and inefficient. Again, just going back to working in the healthcare industry, it sounds so easy to wave a magic wand and make a website, streamlined and efficient. But behind all of that, it costs millions of dollars to be able to do some of those kinds of transformations. And this goes back to, you know, unfortunately, just being outnumbered by the Republican supermajority, it's going to be very difficult to channel that money without really changing minds and changing the electorate. But you know, some of the systems that we have in place right now were built in the 70s and the 80s, and we just haven't had legislatures that have decided to invest the money on upgrading the infrastructure. I mean, imagine trying to run this Zoom meeting on Windows 95. It would be a nightmare. But, you know, that's basically what we're doing with our healthcare system. So, you know, trying to bring it back to, you know, the messaging and the doors and getting people to understand why it's important. That's been working for us. And I guess we'll see in the general election if it works completely. But anyway, just wanted to chime in with that.
Okay, great, Colin. Thank you. Don.
Just one follow-up point on that, Colin. You know, the system is designed to screen people out, and along with that, to scare them. Okay, that God forbid if I fill this out wrong, I'm going to go to jail. Okay, and you know, in contrast, in Costa Rica, you don't have to go. All you have to do is be a citizen, and you show up at the clinic or you show up at the hospital. Matter of fact, if you want a COVID shot, they come to your house. So, you know, it is structurally, and this is a universal problem in this country, we spend, in this bureaucracy that we have, is we spend all this money about money, who's going to get paid and how, in the process of screening people out of the system to keep them from getting something they should not have not earned, okay, rather than just focusing on the mission of good public health and wellness. So the ideology behind this, you know, you write the programs, but again, one of the things we have to confront is this basic ideology and mission that they're focused on screening people out rather than saying, hey, we're engaging you as a healthcare consumer, and if you're eligible, we certainly want to make sure that we help you in a friendly, embracing way, rather than, hey, if you make a mistake here, and you know it's a long, arduous process, you're going to go to jail.
Okay, who else needs to see this Zoom meeting? In other words, what about the Democratic Party here in Missouri? You talked about messaging from going from a local to a statewide perspective. You think they can help us out at all? You think that should be helping us out? Okay, Melissa?
Well, first of all, should they and could they are probably two different questions. No, I mean, I think this is all very, very important, but I think this comes down to like what Sarah was talking about. You know, this is finding, until we get back to having some sort of control over anything in Missouri, this has to be done, you know, administratively, like Sarah was talking about. I know I've talked to Trish Gunby about this before, and she has said similar things about trying to find some sort of common ground on something that you can convince a Republican of, that you can then get them to sponsor, let them take the win on it so we can at least get something done. And I think until we get to a place where we have some say in anything, we have to take wins wherever we can get them. And being as creative as we can in doing so. But I mean, obviously, I think the more the merrier in terms of showing this, because I think this is all very important. And I think I know what Don has shown us here is about healthcare, but I think that it is actually true of anything and everything in the Missouri government right now, because I think the Republicans, you know, like Colin was just saying, they say one thing, they do the other thing. They just want to be in control. I don't think they care about whether or not women have abortions or not. They just want to be able to say that they're still in control of the government or whatever they want to be in control of for that moment. And, you know, it's like the ants and the grasshoppers, right? If all of the ants finally realize that we outnumber them, then the grasshoppers are out of power. It's the same here. We have a lot of people who, Colin, I'm sure you're experiencing this too. Democrats, when you knock on their door and you ask them if they want a yard sign, I don't want to offend my neighbors. I said, hey, they don't care if they offend you. So put your sign up and let your neighbors know that you're a safe space.
But not to mention, 3 doors down, your neighbor just told me the same thing, right?
Correct.
And there's a whole lot more Democrats on your street than you would ever believe.
Yes.
No, they're not alone.
Yes,
I mean,
I know that experience.
Right. And I had a street last week when I was out and the first person said that. And I said, okay, well, you know, I got her to put up the sign. 4 more signs went up that day on that street. But we all think we're the only one. And we have to stop being afraid of standing up for the things that are human and decent, which is what I've been saying on the doors. Like, we're trying to bring back civility, decency, kindness, normalcy. Like, let's just do some of those things for a while.
I don't know why that misperception exists out there, because I've run into that as well in certain neighborhoods in particular. And I say, no, this person right over here, they're Democrats too. You'd be surprised. So I don't know how. It must be that we're not speaking up enough. Marty, you had a question?
No, I just have one comment. Yeah, we're getting specific with back to healthcare, Medicaid expansion. That you know, people can't afford it, can't do this, can't do that. 38 states have taken it, and none of them had a law saying they could no longer reject it. But none of the 38 states that I'm aware of, and there may be more who've taken it now, have backed out and saying we can't afford this and it's not doing the job it's supposed to do. So just the practicality of, hey, you know, something that works, obviously, everybody who has tried it agrees it's successful. And let's work on improving people. And you can ask them, you know, which do you prefer, helping people stay alive or letting them die? And let them answer the question. So, because those are the only 2 alternatives. Either we help them stay alive through our taxes, or we let them die. So,
Helena posted to the chat about Alex Johnson being a contact for the party. He would encourage you to write letters to the editor. Colin, love it. Anything we collectively can do to raise awareness at big levels, i.e. letters to the editor or sharing things. I intend to share with various people in the party, at least raise awareness that this could be a very winning issue for Democrats. If it's messaged right? Okay. Any other comments? Questions? I had a question. I'm not quite sure I understand. When we talk about proceeding administratively, I'm not sure I know what is meant by that. Anybody?
So I'll jump in here, I'll jump in here. Proceeding administratively basically means that through the administration, like Department of Social Services or Department of Health, rather than passing laws to say that they have to do something.
You mean like direct intervention in some way with that department?
Yes.
Okay. Don has a comment. Don, can't hear you.
A follow-up on that and a little history. And this may have been, one of the few times over the years that has been done successfully, the administrative change. So in 2014, with this adult day program that I was talking about, they were being badly, really abused, in essence, by what we call the MMAC, which is the audit group, and finding providers. In one case, a provider was, the proposed fine was $1 million. Okay, And it was totally incorrect. Okay, so with the help of Maria Chappelle Nadal, who was a senator at the time, who had worked for Lieutenant Governor Maxwell, she was very knowledgeable of the players and the process. We actually got a bill with the help of Rick Stream passed through the legislature, and everybody's like, how in the world did you get something done in healthcare? So it can be done, but that was a very small bite. But it was bipartisan.
Melissa, you have a hand up?
Yeah, I mean, like I was saying earlier, trying to find ways to be able to work bipartisanly, together, finding issues, whether it's in healthcare or not, that we can start to build something on. My daughter has severe food allergies, so we have had EpiPens in our lives since she was 4. EpiPens, just like insulin, just like Narcan, are not things that see Democrats versus Republicans. So everybody could have to have them. They are ridiculously expensive. EpiPens in particular are one of those things that cost stupid amounts of money, and you hope you don't use it. And then you hope that next year you get to buy it again and spend that same kind of money. EpiPens are one of those things that are currently prescription, and you can't have them just publicly. And one of the things I would love to see happen is that they are in public locations like cafeterias, food courts, places where large groups of people are eating food, because more often than not, someone finds out that they have anaphylaxis from eating something, not because they knew ahead of time. Most often you have anaphylaxis and there is no EpiPen. And so that could be up on the wall with the AED heart monitor to be switched out yearly. And that to me is something that, yes, there is a cost involved, but yes, there is a cost savings, like Colin was talking about. This is preventative. We can keep somebody out of the hospital long-term. Things like that, things that we could try to work together on and make some progress, little steps, right? If we can do this, then we can do that. Those would be things that I would want to try and start with, because I feel like we just have to get back to working together and hope that that does something. Also, I think it would save lives. So that's a good thing.
Okay, I think we're coming near the
Can
end.
I say
here.
what? Can
Go
I
ahead,
say one
Helena.
random thing?
Go ahead.
Helena, sorry. So I'm working on this project for a client, and it's all about newborn screening. And it's newborn screening for genetic mutations that cause rare diseases that either, the baby will die soon without care, or maybe can live a full life if they get medical care immediately, when they're born. And I was shocked, but Missouri covers a lot of newborn screening, more than some other Republican states. So this is just random and it has nothing to do with anything, but I just find it fascinating. These advocacy groups for different sorts of genetic mutations, these disorders, a lot of these things end up on the screening for the state because a parent group worked with a medical group to advocate and lobby to get them on there. They're not, required. And I just find it fascinating. We care about that, but we're not then creating a system where we keep those kids like those. I mean, most of them get their care through Medicaid. I'm just saying, it's amazing to me what can be done if you have all of this energy behind a specific cause, kind of like what Sarah was saying. But it's odd that we don't care if people get medical care. We're spending all this money on newborn screening for every newborn, but we're not keeping people healthy who are born healthy, but then may develop something later. I think it's there. I don't know. There might be something there, maybe not. But I just thought it was weirdly encouraging that Missouri does a really comprehensive newborn scan. So
Go ahead, Don.
Well, an example of that, and I'm maybe not getting but there's the Missouri Cares, maybe, I forget. But we have the capability to do advanced stem cell research because the Danforth Foundation did exactly what you're talking about and said, we're going to pass legislation that protects stem cell research in Missouri, which, as you can remember, there was a time when that was a very hot political issue with the right to life movement. Okay. But yeah, so if we can message effectively and get these organizations on board, they can be powerful allies, but we have to, I think we have to do messaging on these issues much more effectively as progressive groups. And that's, not just the Democratic Party, but as other organizations in the community. We got to collaborate more on our politics. But so many people are afraid to talk about the politics.
Marty.
Yeah, to direct to Helen is, yeah, we have in the state of Missouri better coverage for autism than most other states, because by God, we fought hard for it. Specifically, a guy named Eric Schmidt, a former neighbor. He has an autistic son, and the great thing was that, yeah, while they were, I understood there were like two others in the legislature, Republicans, who had autistic kids, and they forced insurance companies to improve the coverage for autism. Now, according to Jeannie Kirkton, who was in the legislature at the time, there was discussion in Medicaid about reducing coverage for autism. So yeah, which side are you on? And if you have become a Republican and you can get anything passed to help you. So that's part of what might have happened with Helena's case. Maybe some Republicans were interested and involved in that and got something passed.
Okay, thanks, Marty. Okay, any other issues, questions? Well, let me echo what Melissa has written. Don, that was a great presentation that you put on today. Glad we finally got you on. And a great discussion by everybody. Glad to see the legislators and candidates here. Hope it will help you somewhat. And MOPAG will try and communicate this information out best we can to people who can run with it. And I think that's about it. Susan, you got anything?
Just that on our agenda, we had a segment on announcements. And so if anyone has any announcements of meetings or events that they want to make, we should do that now before we close.
Colin?
So just kind of a blanket statement, kind of recapping the entire conversation, knowing that we really need to flip seats. Both Melissa and I are going to have almost weekly and sometimes more than weekly events going on, Canvas events and things. So I would just ask everybody, stay apprised on our websites and social media. One of the biggest ways that we can make a difference right now in Missouri is to flip these seats, and her and I's are both flippable. So I would say one of the best actions you can do is help us flip those seats. And, and if you go to the Missouri House Democrat site, you can see some of the other seats that are flippable. There's about 16 hot races. Again, Melissa and I are among them. And the more seats we flip, then the easier of a conversation this is going to be when we need to do things legislatively. So thanks again so much for having us.
There's an effort I've seen where 8 districts have been targeted. Are you familiar with that? Are you part of that 8?
We're part of that 8. In St.
Okay.
Louis County, there's 8, and I think across the state, there's 16. Mohawk's website has all of those. They've got a little fire icon next to them, but yeah, in St. Louis area, there's 8. And again, Melissa's district and mine are among them.
Okay, thanks for the clarification. Okay, then, going to sign off. Thank you all for coming again. Take care.
Well.
Stay healthy.
Been a productive meeting. Thank you all.
Thank
Thank you. Bye, everybody.